guys, and we are live with Tuesday Tips with Dr. Vida here at Pure Plastic Surgery. This is our weekly topic discussion. We discuss different topics in plastic surgery and we answer your questions. So today we are going to talk about massive weight loss patients and the special considerations or things that are a little bit different or we have to be checking out with massive weight loss specifically, okay? So what is massive weight loss? So there are different definitions about what is massive weight loss, but usually a 75-pound weight loss is considered a massive weight loss. And why say massive weight loss and just don't say just weight loss? Well, because of the special considerations that we have to address and be careful and check with that amount of weight loss. The body changes a lot. So those things are going to be important when we're doing the pre-op, the intra-op, and also in your post-op course. So we'll talk a little bit about this. What is the most common massive weight loss patients? What's the most common cause or the most common reason why they are able to lose that amount of weight? It's because of bariatric surgery. And I think bariatric surgery has been popularized a lot in the last few years. I think in the last 10 to 15 years, we've seen more and more of this surgeries done because it's an absolute amazing tool for patients that are high in their BMI and also have comorbidities that are very hard to manage with the weights that they have, a BMI more than 35, more than 40. Okay, so we've seen a lot of patients with amazing transformations, lifestyle changes, and putting their lives back on track after these surgeries. And we've seen how the surgeries are now more and more safe. And more tolerable for the body, okay? So what are the two most common procedures are gastric bypass and a gastric sleeve. We also have the gastric band, which is the third one more common, okay? So let's talk about like 10, 15 years ago, the gastric bypass was actually the more common procedure. But the gastric bypass is a little bit a more involved surgery because there's some cutting of tissue and repositioning of the small bowel to the stomach, which causes more weight loss, but also nutritional deficiencies, and we'll talk about that. The gastric sleeve involves just trimming part of the stomach up, so making it smaller. So the weight loss that you see with gastric bypass is not as severe, but also the nutritional deficiencies are not as severe or as marked, okay? So it's a more tolerable surgery. We're seeing surgeons that are doing this surgery ambulatory even, or staying in the hospital one night, and the recovery, they're doing it laparoscopically or robotically, so the recovery is very good, and the weight loss after the surgery, it's in a year or less. In a few months, you're seeing drastic changes. So what happens after this? The excess skin and the excess tissue that is left behind. And that is when body contouring surgery comes into play. So one of the most common questions I get is, when can I start the reconstructive part of the weight loss, which is the body contouring procedures after a massive weight loss surgery? Well, there are two important landmarks, okay? And this is a little bit different from surgeon to surgeon, but usually everyone asks for a time from the surgery. Why? Because there is an initial weight loss, and then it may happen a weight gain, not to the extent of the initial weight that you were, but a weight gain, and then it starts to fluctuate up to it stabilizing, okay? And that is the reason why waiting is important. I like to wait a year after your bariatric procedure, okay? But there is a second consideration, which is the weight stability, okay? There are people that reach that stability sooner, and there are people that reach that stability later. So at least 1 year after your procedure, but at least 6 months with a stable weight.
And I think that is even more important than the year after surgery. Because if you're a year after surgery, but you're still in your weight loss journey, or you're still in that up and down, that it's not stable. And don't get me wrong, there's always going to be fluctuations in your weight. Like, there's no one in this earth that can say, I'm 130 pounds and I'm 130 pounds forever. No, we all fluctuate in our weight, and that is completely normal. But a 5-pound up and down gain in weight and losing weight, a 5-pound ratio, it's okay. It's completely normal. When I'm talking about fluctuations like 15, 20 pounds that you're up and down, if you're still in that fluctuation, you should wait and have stable weight for at least 6 months, okay? Why is it important? One, the waiting 1 year has to do with the fluctuations in weight, but also in the nutritional deficiencies that I'll talk a little bit about that. And the 6-month stable in weight is so you finish that fluctuation and we're in a stable weight. If you have surgery and you're still losing weight, then that surgery is not going to be optimal for you, okay? If we go ahead and do, for example, a tummy tuck, tighten everything down, remove the excess skin, and then you lose 30 or 40 more pounds, then that excess skin will sag. It's not going to sag to the extent that it was before. That is right. But it's not going to be as tight as if you would have waited for those 30, 40 pounds, you're stable in that weight, and you do the surgery. Your results are going to be better, and your results are going to be more long-term results, okay? So that's very important. 1 year after surgery, 6 months after stable weight, okay? So what is the ideal body weight? That it's a discussion to have with five is important, okay? For some people and some nutritionists will the goal is going to be different. BMI of 27, BMI of 28, that, and you reach your goal, right? But at least a BMI of less than 33.5, okay? Nutritional deficiencies. So this is, I think, one of the most important special considerations in massive weight loss patients. And it's the nutritional deficiencies that happen after, especially gastric bypass surgery. The most common, anemia, iron deficiency due to the absorption of iron in the stomach, okay? When you do a bariatric procedure, you lose some vitamins and a factor that helps your body absorb the iron, okay? So a lot of patients are anemic after the procedure and need to have iron supplementation after, okay? Why is it so important? Because any surgery involves bleeding. So you have to have at least 11 of hemoglobin before having surgery. And your iron levels should be max, or at levels, normal, right? So you should keep your supplements, and I'm gonna put you in supplements, especially if you're having liposuction, because with liposuction, the risk of bleeding is a little bit higher, okay? So what other nutritional deficiencies are very common? Iron, like I said, is the first one. Other vitamins like vitamin B12, and actually vitamin B12, it's also an important component of the hemoglobin levels. So anemia is associated with low vitamin B12 levels. So you have two factors there dropping your hemoglobin levels that you need to supplement. Other vitamins that are low are vitamin D, vitamin K. Vitamin K is used in our bodies for blood coagulation, okay? So blood clot forming, which is important to stop bleeding, okay? So vitamin K levels should be good. Vitamin D and vitamin E. Vitamin E is important on wound healing, okay? So deficiencies in all those levels are gonna predispose you to, one, have low hemoglobin levels, recovery harder, two, wound healing problems. The albumin tends to drop, and another blood test called prealbumin that is very predictive of the nutrition in your body usually is low, okay? So why is the importance of this is that you'll need to supplement adequately, so have those nutritional levels optimized before surgery to decrease the complications such as bleeding, low hemoglobin needed for blood transfusion, and wound healing. Okay, so especially, like I said, in gastric bypass, gastric sleeve patients also tend to have some nutritional deficiencies, especially iron, but gastric bypass specifically, okay? So this is very important to have your primary care check your vitamin levels before thinking about surgery to make sure that you're optimized as much as possible, okay? Skin quality, and I think this is one of the most important things to understand after massive weight loss and body contouring after massive weight loss. The skin has already been stretched almost to its limit. And even though you lost that weight, that collagen has been stretched. And like a rubber band, when you stretch a rubber band to its max amount, that rubber band goes back some, but usually it doesn't go back to the original size. And that's what happens to your skin, right? It has been stretched to an amount that the collagen fibers are not able to go back to their original size. And even though I'm gonna cut the excess skin and tighten it as much as possible, that skin usually in my massive weight loss patients has lost the ability to retract. So the swelling is gonna stretch that. And after the swelling comes down, it is very normal to have still some laxity in the skin, okay? Not the laxity that it's gonna hang over like it was before, but laxity like sometimes I see my body contouring patients, like I can still pinch and I can still stretch my skin. And that is because of the skin quality. The collagen has been stretched and the ability to bounce back has been lost, okay? That is why the body contouring patients after massive weight loss tend to have more revision surgeries to kind of remove a little bit of a dog ear, a little bit of a stretching here, some asymmetry, especially in the arms, a little bit of excess skin in the elbow area. And it's because in a person that has not gone through massive weight loss, the skin has that ability to retract and kind of tighten everything with the compression. With massive weight loss, I don't see this much. It's not that everybody's gonna experience this, but it's very common, okay? And in relationship with the skin quality, I wanted to talk about the breast shape and volume, okay? Another very common thing is I used to be a triple D, a very big chested person, and now after I lost the 150 pounds, I don't have anything. Well, remember that breast tissue is mainly fat. So when you lose all this weight, you also lose that breast parenchyma around the breast tissue that it's mainly fat. So the breasts are deflated, which means that a lot of the body contouring patients after massive weight loss are gonna benefit from implant placement to add that volume that they lost, okay? But one of the things that is important to understand is that like the skin lost its ability to retract, it also lost its ability to hold weight, okay? So putting a very large implant is just gonna sag because your skin is very thin and the skin is not very tight to hold that implant, okay? So one of the things I do recommend in some of my massive weight loss patients is what's called the internal bra. The internal bra is a mesh that I put on the inside to help hold that breast tissue and or implant, depending on the case. And it's not 100%, but it helps with the degree of ptosis or droopiness with time, okay? It is an absorbable mesh, so it's not something that's gonna be permanent there, but the good thing is that even though it absorbs, the tissue that it leaves behind, it's like a scar tissue. It's a thicker, more supportive tissue that helps to support that breast and also implant if you decide to put an implant, okay? It's when we're combining the breast lift and implants, there's a limit of how big we can go. So it's not uncommon that the breast lift with implants that I do on the massive weight loss patients require 2 surgeries to achieve that final look, okay? The first surgery is going to be the breast lift, reshaping, putting an implant, but an implant that is not too big, because remember, the skin is already very thin. If I put a big implant, it's gonna open up and you're gonna lose that implant, okay? So on that first surgery, it's a reshaping, putting the implant, plus or minus putting the internal bra for support, having everything heal, and then you decide if you wanna go bigger, if you wanna fill more of that space, then we can then do an implant exchange 3 to 4 months after the original surgery, and then we can go with a bigger implant that suits your goals, okay? So it's a very important to be safe because of the tissue quality, okay? Blood clots. So blood clots, my massive weight loss patients unfortunately are at increased risk of blood clots. A little bit more than the regular population, okay? So it is very important to be very strict with your post-op care, meaning ambulating, okay, getting out of bed and walking even the same day of surgery. And if you're having a tummy tuck, I'm gonna give you a device that you're gonna put in your legs. It's called the Circulate or Venapro, and in the hospital is what we call a sequential compression device, okay? This one that I'm gonna give you is battery operated, and you take it home, recharge it, okay? And you put it on the calves to massage the calves. You put it on at night and when you're resting, okay? Super important. And let's talk about multiple surgeries, okay? So massive weight loss doesn't affect just one area of the body. It affects the entire body, okay? From the face, deflates the face, neck laxity, breast ptosis or droopiness, in males gynecomastia or that excess skin in the chest, in the belly we see the excess skin, the muscle separation, on the back we see the excess skin, buttock ptosis or droopiness of the butt because of the weight loss, excess skin in the thighs, excess skin in the arms. So how do we organize all of these areas of concern, and what do we do first or last? Well, at the end of the day, it's a very personal decision. What bothers you the most and what areas you want to target first, okay? But there are some surgeries we can safely combine, okay? What's the goal? The goal is to be under surgery, under general anesthesia, less than 4 hours, max less than 6 hours. I don't do any surgeries that long, but I'm gonna tell you at least less than 4 hours to decrease the blood clot risk, okay? The longer we are under anesthesia, the higher the risk of blood clots. And also, the higher the risk of having wound healing problems, okay? So less than 4 hours. And we don't wanna combine surgeries that affect the recovery of one another, okay? So usually I like to start in the trunk, okay? So that's usually the area that we can target different ones and put a lot of them together safely, because we're working in one area and I don't have to change positions, so I can combine different surgeries. So we get a couple in one surgery and one intervention, okay? So what's the most common? Doing the torso and the abdomen. So the chest and abdomen, either gynecomastia and tummy tuck in males, or breast procedure and tummy tuck in females, okay? With that procedure, because we're gonna be laying on your back and I'm gonna be working in your chest and belly, adding the arms does not add a significant amount of time. So we can add the arms and do the arm lift with the chest and belly. So that's the most common for my massive weight loss patients. 3 procedures, so the chest, the belly, and the arms, okay? Once we do all those 3, it depends on the other areas of concern, okay? So after this heals, usually after 3 to 4 months is when we can schedule the second procedure. And then it depends. Usually the back is one of the areas that it's of concern. If you have more excess skin in the upper back, we can do an upper back lift, which is excising the little rolls of skin that form up here around the bra line, and it's basically extending the incision from the breast lift all the way towards the back and excising those excess skin rolls in the upper back, okay? Or if you actually have more excess skin in the lower back, and with that some droopiness in the butt, then we have two options here, okay? Do we do a BBL, which is liposuction with fat transfer, or we do an actual buttock lift or an lower body lift? It depends, okay? Depends on the amount of excess skin that you have and the droopiness and the amount of fat you have available. Usually massive weight loss patients, you guys think you have a lot of fat, but you actually don't. Most of the time, what you have is excess skin, okay? So when we do liposuction on excess skin, the amount of fat that I obtain is not that much. So, and to see a result, an actual adding volume on the bottom, you have to have skin that supports that fat. If the buttock is droopy and it's very saggy, and I inject fat, the fat is just gonna drop, okay? So in order to be a candidate and to have a good result from a BBL, lipo with fat transfer, the buttocks shouldn't be that droopy, can be a little, but not too much, and you have to have fat available, okay? And then we can do contouring, lipo, and fat transfer to the butt. If you have a lot of skin laxity with ptosis or droopiness of the butt, then you're a better candidate to do an actual lift, excising that excess skin and pulling the buttock up surgically. It's an incision that it's going to extend from the tummy tuck one connecting to the back, okay, all the way on top of the buttock, and that's going to lift everything up, okay? The thighs, I like to do them separate. Why? Because the recovery for the thighs is going to be a little bit harder because of the position of the incision right in the crease in between your legs, close to the genitalia, an area with high humidity, with high risk of infection and wound healing problems, okay? So it's better to isolate the surgery, have it alone so you can recover better from it and have decreased risk of complications, okay? So the thighs alone. The neck, I also like to do it alone. Why? Because it's a delicate area. It involves delicate dissection of the skin, of the muscles, pulling it, and it's gonna take long. It takes at least 3 to 4 hours to do a facelift, neck lift, that it's a good result, okay? So I don't wanna be adding another surgery, to be rushing in a surgery that it should take time to be very precise and to have the best results, okay? So usually those are the most common combinations. I'll take some questions now.
Should I get a lymphatic massage prior to tummy tuck surgery?
Prior, it's not gonna affect that much the result. You can, but after the surgery, very important, okay? For the first 2 weeks, it's important not to be massaging the areas of the incision, okay? So the massages for the first 2 weeks are gonna be focused on the areas of liposuction, which are on the waist and flanks area, okay? They can massage the back as well, but not the front until 2 weeks post-op.
Okay, next one. Okay, implant capsulations. Warning signs and prevention tips, please.
Awesome. So capsular contracture, it's a possible complication after an implant procedure. It can happen with either saline or silicone implants, okay? The tips to decrease the risk of capsular contracture, a lot of the initial risk reducing things are actually from the surgeon. So antibiotics that I use to irrigate on the implant, antibiotics that I'm going to use while I'm doing the surgery to clean inside, actually in the pocket before putting the implant, IV antibiotics that I give you while you're under anesthesia, using a device that protects the implants called a Keller funnel. It's basically like a plastic funnel that I put the implant in and put the implant directly in the pocket without touching it. So it's called a no hand technique. So we're not touching the implant to decrease bacterial colonization or overgrowth in the implant, okay? All of those things decrease bacterial count, decrease risk of capsular contracture. Then afterwards is drinking or taking your antibiotics prescribed in that first week that I'm going to give you, okay? And massages, I don't recommend doing massages for every single patient, but there is a subset of patients that I'm going to recommend starting massages, and I'm gonna let you know, okay? But as a rule of thumb, I don't like to be massaging the implant, okay? And the other thing is, if you start to see either the implant starts to become painful, or one starts to become a little bit harder than the other, let me know right away, because we can start you on medications to try to decrease the severity of the capsular contracture.
Do you put drains in a brachioplasty?
I don't. The only surgeries that I put drains is in the tummy tuck and in the lower back lift. In the breast, I don't put drains unless something specific, but usually, this are my usual cases, breast or brachioplasty, I don't.
Okay, this is not a question, this is just a message. And good to have surgery with you on February 1st. Can't wait to meet you.
Awesome, can't wait to meet you too.
If labs are good, but the WBC count, white blood count, is a slight low, can you still have surgery if PCP clears you?
It depends, okay? Send us a message through Clara. It depends. We'll have to check all your medical conditions and see the reason for that, okay?
Okay. Does a tummy tuck include mom's reduction?
Yes, so the tummy tuck, the mons area, and this is an area of concern of a lot of my massive weight loss patients. This area tends to droop, okay, with the weight loss. Not only the excess skin, but also the mons area. It depends on if the mons area is a excess skin problem or an excess fat problem, okay? Both I take care during the tummy tuck procedure, but if it's a fat problem, I do liposuction to that area. If it's an excess skin problem, I do the incision low to pull it up, and I put some stitches on the inside to secure it and make sure it is lifted.
How soon after a mommy makeover do you need to start massages?
After a mommy makeover and after liposuction procedures, you're gonna start the massages the next day. And for the first 7 to 10 days, you're gonna be having one a day. Usually after that, it depends on everyone, but usually at that point, you're good to start winning the massages. So every other day, twice a week, and so on and so forth.
What's the highest BMI for Lipo360?
For Lipo360 and any procedure is a highest BMI of 33.5. If you can get a BMI less than 30, that's ideal to decrease complications and and improve your results.
Okay, for the thigh lift, how long I should wait before going back to work?
It all depends on what you do for a living, okay? So the first 2 weeks are gonna be the most important ones to protect the incisions. So at least 3 weeks at home, I would advise. At 3 weeks, it depends. You're still gonna be limited on heavy lifting and exercising. So you're not gonna be able to lift more than 10 pounds and nothing strenuous, okay? So if you tell me that you're an MMA fighter, I'm gonna say 6 weeks. But if you work on a desk, then 3 weeks should be okay.
What are the best implants for a lift? I really want a pretty cleavage.
So I usually recommend using silicone implants, but it all depends on your goals. We have silicone and we have saline implants. Both are equally effective, but generally silicone implants tend to feel more natural. And if they rupture, they're not going to deflate in the moment like a saline implant, and you have time to plan for the revision or replacement surgery.
Okay, and this is for our YouTube viewers. How long does it take to know if you are cleared for surgery after all paperwork is submitted?
After everything is submitted, usually give us like 3 to 5 business days, and you should be receiving a message in Clara, our HIPAA compliant messaging system, saying that you're cleared for surgery. Awesome, guys. So thank you so much for all the questions. Hope this helped, and I'll see you guys next week on Tuesday Tips. I have some openings on February, okay? So if you guys want to consider those slots, give us a call or message us, and there are gonna be some information there for you. But give us a call right away because there's not that many, okay? I'll see you guys next week, okay?